first slicing technique that I would like to share. Basically, when I do this slicing technique, you do a slicing technique until you can get into the endometrial lining. So this is the video that I will do a slicing technique. It's very safe to avoid inadvertent injury into a deeper myometrial layers, which leads to charring or escharment. See, if you can see the strawberry lining, the strawberry, what they call a surface of the strawberry lining, meaning you are already still the endometrial cavity. Sorry, can I just? This is what I call just now as a slicing technique. That when you can see the strawberry appearance here like this, meaning you are still within the endometrial cavity and you have a margin of safety before go and scrape it with the cold technology, cold scraping technology. So after this, we can use without the activation of cold knife. Okay, this same technique I applied to my first case scenario. She was 39-year-old, parity 2, presented with menorrhagia for 3 months with background of polycystic ovarian syndromes. And the histology come back as endometrial hyperplasia. And this is the first picture during his first hysteroscopy that I applied thin slicing technique. And this is the picture after I completed the resection. And then I bring her back 6 months later for second look during removal of Mirena, because as you know that the histology finding was endometrial hyperplasia. And as you can see here, we don't see any charring or any evidence of Escharman syndromes. And 6 months later, she conceived and she delivered a term and healthy baby girl. So in that, my take-home message here is please do not hesitate to perform resections on patients who still wish to conceive. And then I did mention just now about cold cutting without activation of cutting energy. This cold cutting technique I normally use in cases where when the patient was referred to me for secondary hemorrhage due to incomplete evacuation product of conception, or when the abnormalities is actually at the cornu end. So this one here, I use the loop without activating the energy, the energy device. So in this case, I use a combination of cold cutting and also some energy cutting if the tissue appear very thick. Okay, this one here, basically, I just use the loop because the loop is quite strong, so therefore we can just clipping it like the DNC. The same technique also I use to remove if there is, sorry, this is not long. The cold cutting at the cornu end of the uterus, because we know that at the cornu end of the uterus, there is a risk of perforation is quite high because of the thin layers of this area. In this case also, towards the end of the procedure after DTNC. I also don't use any energy cutting. And the last technique that I use is backstroke cutting. It's only possible with RF technology because it doesn't cut deep into the myometrial layers. And this kind of backstroke cutting, normally I use only with the RF technology because it doesn't cut deep into the myometrial layers. You can also use backstroke cutting without activation of the cutting energy because the loop is quite strong. So basically you can use it like you do a direct biopsy with this loop. Okay, the second scenario meaning the case scenario number 2. Why I wanted to bring this case scenario, because I have quite a number of cases which was referred to me for negative finding after hysteroscopy and DNC, but due to the persistent abnormal bleeding, so I did second hysteroscopy with direct biopsy using RF technology. So if you can see here on this screen, the lesion number 1 is actually just normal endometrial polyp. But on this part here, as you can see, the lesion number 2, after I remove this lesion here, it comes back as sarcoma. So in that sense, it is very important for us to do a second procedures for those patients who still have abnormal period or abnormal menses, despite of negative finding from the first hysteroscopy and DNC. So the take-home message: resection is useful to determine abnormal growth within the endometrial cavity, and do not hesitate to use in those patients who has been completed family or who has not been completed family, or some for those patients who have some infertility issue. And use of RF reduce thermal damage to endometrial lining, and do second assessment with resection should the patient is still having persistent abnormal bleeding. Thank you.